Hi, I'm Kayla Taylor, and welcome to Kayla Tailored Wellness. I am a family nurse practitioner that specializes in integrative medicine. So what that means is not only do I get to care for patients traditionally in the healthcare clinic, but I also get to treat them holistically with lifestyle changes and using vitamins, supplements, and herbs. So today I want to review common medications that are prescribed and what vitamin deficiencies they can cause. But first, smash that like button and hit the subscribe button for the YouTube algorithm. So just remember, I am not your healthcare provider. I do not know your allergies. I do not know your past medical history. I do not know what medications you are taking. So please use the information you learned today to have an educated conversation with your primary care provider. Medications are very beneficial. They keep people alive. However, many patients and providers don't know what medications cause which vitamin deficiencies. And so I want you guys to know so you can make sure those vitamins are being tracked in your lab work, and also to take supplements to make sure that you don't develop vitamin deficiencies. Common blood pressure medications such as ACEs, otherwise known as angiotensin converting enzymes such as lisinopril or any medication that ends in PRIL, pril. ARBs such as angiotensin 2 receptor blockers like losartan or medications that end in sartan, SARTAN. Or thiazides such as hydrochlorothiazide, all can develop zinc deficiencies. Thiazides can also cause sodium, magnesium, and potassium deficiencies. However, they can also increase calcium, so may be beneficial in somebody who has osteoporosis. So you can supplement with magnesium, 200 to 600 milligrams a day, and zinc, 20 to 30 milligrams per day. Another blood pressure medication are beta blockers, such as metoprolol or propranolol. So they can cause deficiencies in melatonin, which can help you sleep, and coenzyme Q10, CoQ10, which is an antioxidant and provides energy. You can find CoQ10 in meats, fish, and nuts. Another blood pressure medication is loop diuretics, such as Lasix or Bumex. So the mechanism of action is that it blocks sodium, potassium, and chloride from being reabsorbed in the kidneys. That way it pulls the water into the kidneys for excretion. The risk, though, is that it can cause deficiencies in these electrolytes. It also blocks reabsorption of calcium and magnesium and can cause deficiencies in B1, which is thiamine, and B6. So you can replete with B1 25 to 50 milligrams per day and magnesium 300 to 600 milligrams per day. Another diuretic for blood pressure would be the potassium-sparing diuretics, such as spironolactone. So those help cause diuresis for the blood pressure without losing potassium. However, those can cause deficiencies in sodium, calcium, folic acid, and zinc. Some medications can deplete vitamin D and calcium, leading to osteoporosis, which is low bone density. These include glucocorticosteroids, aromatase inhibitors for breast cancer, antiandrogens for prostate cancer, PPIs such as proton pump inhibitors, which can be used for heartburn, antiretrovirals that can be used for HIV or herpes, SSRIs and SNRIs, so selective serotonin reuptake inhibitors and selective norepinephrine reuptake inhibitors for depression, antiepileptics for seizures, loop diuretics for blood pressure or congestive heart failure, and heparin and other anticoagulants. Another medication called methotrexate that is used for cancers, rheumatoid arthritis, and psoriasis gets rid of folic acid as waste. So it's important to be on a folic acid supplementation if you are taking methotrexate. Another common medication that is both prescribed and over the counter are PPIs, otherwise known as proton pump inhibitors. These include Protonics, Prilosec, Nexium, and they're used for patients who have over acid production in their stomach, they're getting a lot of heartburn, they're getting stomach ulcers. This can block the absorption of iron, so it can be used in patients who have hemochromatosis or iron overload. PPIs can also block the absorption of calcium, magnesium, and B12. You'll want to monitor labs for calcium, magnesium, iron, vitamin D, and B12. While on a PPI, you can take B12 25 to 400 micrograms per day, magnesium 300 to 600 milligrams per day, and vitamin D 2,000 units per day. You do not need to replace the calcium. In patients who have diabetes, they may take a medication called sulfonylureas, and this includes glimepiride or glipizide. Or patients who have high cholesterol may take statins such as atorvastatin or simvastatin. But these can cause deficiencies in the enzyme CoQ10. Deficiencies in CoQ10 can cause fatigue, shortness of breath, and arrhythmias. Another commonly prescribed diabetic medication is metformin. Along with pain medications such as aspirin, Tylenol, and hydrocodone, can all cause B12 deficiencies. So even though a diabetic can get neuropathy, like a numbness and tingling in their fingers and toes, B12 deficiency can cause a neuropathy. And so it's important to check B12 deficiency if somebody's been on metformin for long periods of time, because this helps the production of healthy nerve and blood cells. Another cholesterol medication is the group bile acid sequestrants, such as cholecystiramine. So this helps lower triglycerides, but can also decrease vitamin K, which is important for blood clotting. Along with cholecystiramine, the medication SulfaSalizine, which is used in ulcerative colitis, methotrexate, which is used in autoimmune disorders, and Accutane, which is used for acne, have all been shown to decrease folic acid. Low folic acid has been shown to cause anemia, fatigue, and neuropathy, which is pins and needles in the fingers and toes. Gingivitis overgrowth has been seen in anticonvulsants such as phenytoin, valproic acid, and carbamazepine, and also in calcium channel blockers for blood pressure such as amlodipine, nifedipine, and diltiazem. For the women who are on birth control, there are a lot of vitamin deficiencies. These include folic acid, vitamin B2, vitamin B6, vitamin B12, vitamin C and E, magnesium, selenium, and zinc. Birth control can increase vitamin K, copper, and iron. And finally, those who are on Parkinson drugs such as levodopa or carbidopa can develop deficiencies in vitamin B6, vitamin B12, and folic acid. So they may consider taking a B complex. Low magnesium can cause muscle cramps, irregular heart rate, and mood changes. Low potassium can cause muscle weakness, irregular heart rate, fatigue, and constipation. Low vitamin B6 can cause weakness, numbness, and tingling in the hands and feet. Low vitamin B12 is very similar. It can also cause weakness, numbness, and tingling, in addition to anemia and confusion. Low folic acid can cause anemia, fatigue, pale skin, and a tender tongue. Low vitamin D and calcium can cause weak bones, increasing the risk for fractures, and bone loss, increasing the risk for osteoporosis. Low zinc can decrease the immune system function, change smell and taste, cause diarrhea, create a rash, and cause hair loss. So that's all I have for you guys today. Check me out on Instagram at Kayla Tailored Wellness. And comment below, let me know if there's any medications that I missed that do cause vitamin deficiencies. And in the description below, I do have a link to competitively priced supplements. And thanks again for watching today and letting me tailor your wellness.